High blood pressure can trigger a stroke, and you might not even know it. 5. Shocking facts you need to hear. High blood pressure, the silent fuse quietly ticking away inside your cardiovascular system. Can you imagine that inside your own body, an invisible pressure is constantly pushing against your blood vessels? Day by day, it's wearing down the strength of your circulation. It's a silent but relentless force slowly weakening your heart, brain, and kidneys without you even feeling it. For millions of Americans, this isn't just a hypothetical scenario. It's real life. And they're living it every single day under the name of high blood pressure. Also known as hypertension, this condition has long earned its nickname, the silent killer. That's because most people don't feel any symptoms even after years of living with it. You might feel perfectly healthy, while inside your blood vessels are being damaged with every beat of your heart. High blood pressure drastically increases the risk of stroke, heart attack, heart failure, and even permanent kidney damage. What's even more concerning is that many people, especially older adults and individuals in Asian American and African American communities, don't fully understand how dangerous this condition really is. You could be taking your medications regularly, but a single skipped blood pressure, reading a saltier than usual meal, or a prolonged period of stress may be all it takes to trigger a deadly stroke. Understanding the true nature of high blood pressure is the first step to taking control of it and protecting your long-term health, especially after age 50. In the next section, we'll reveal 5 surprising yet critical truths about hypertension, facts that may completely change how you manage your health and help you avoid the ticking time bomb quietly counting down inside your body. Don't skip this, because no one can protect your health better than you. Truth number 1. Don't let the numbers fool you. Most people misunderstand blood pressure readings. Every time you get your blood pressure checked at the doctor's office, you're given 2 numbers, 2 values that can reveal a great deal about your cardiovascular health. But many people only pay attention to one of those numbers, or worse, misunderstand what they actually mean. Blood pressure is not a simple concept. It's the force your blood exerts on the walls of your arteries as your heart pumps, measured in millimeters of mercury, mmHg. Here are the 2 numbers you need to fully understand. Systolic blood pressure, the top number. This measures the pressure in your arteries when your heart contracts to pump blood out to the rest of your body. It's the highest point of pressure in the heartbeat cycle. Diastolic blood pressure, the bottom number. This measures the pressure in your arteries when your heart is at rest between beats as it fills with blood. It's the lowest point in the cycle. A common mistake is focusing only on the first number. For example, someone might say, "My blood pressure is 120," without mentioning the second number. But 120 without a complete overvalue is meaningless. There is a huge difference between 120/95, a sign of diastolic hypertension, and 120/75, which is considered completely normal. Both numbers matter equally as they reflect different aspects of how your heart and blood vessels function. Systolic pressure shows how hard your heart is working to pump, while diastolic pressure reveals how much resistance your arteries have when your heart is resting. Another important point many people overlook: blood pressure is not constant. It changes throughout the day, depending on your mood, physical activity, even your posture, or the time of day. A single high reading in the clinic, sometimes triggered by anxiety, is known as white coat hypertension. It doesn't necessarily mean you have chronic high blood pressure. But if high readings occur repeatedly, especially while at rest or at home, that's a serious concern. That's why doctors often ask for multiple readings in different settings or recommend monitoring your blood pressure at home for several days to get a clearer picture. Understanding both numbers and what they really mean is the first step to taking control of your stroke risk and protecting your heart health. Truth number 2. Don't be misled by labels. Understanding the full spectrum of blood pressure. Knowing your blood pressure is a great first step, but understanding where it falls within the medical classification system is what truly empowers you to manage your cardiovascular risk. Major organizations like the American Heart Association, AHA, and the American College of Cardiology, ACC, have created a detailed blood pressure classification scale to help patients and doctors assess health status and determine appropriate treatment. And it's not just a simple case of normal versus high. Each category carries its own meaning and deserves careful attention. Ideal blood pressure. Both systolic top number and diastolic bottom number are under 120/80 mmHg. This is considered optimal, often seen in people with very healthy lifestyles. For example, 110/70 mmHg suggests your heart and blood vessels are functioning smoothly. Normal but slightly higher than ideal. Systolic between 12/0 and 129 mmHg. Diastolic between 80/84 mmHg. Still within a healthy range, but if you're nearing 130, it may be time to reevaluate your diet activity level and overall habits. High normal pre-hypertension. Systolic between 13/0139 mmHg or diastolic between 85/89 mmHg. This is a yellow warning zone. You haven't been diagnosed with hypertension yet, but you're headed in that direction if you don't make changes. If you have existing conditions like diabetes or kidney disease, this level may already warrant medical intervention. Hypertension. Official diagnosis. Blood pressure consistently measuring at 140/90 mmHg or higher qualifies as hypertension. According to newer guidelines, such as those from the AHA-ACC, a threshold of 130/80 mmHg may already call for action, especially if other risk factors are present. Stage 1. Hypertension systolic. 130/139 or diastolic 80/89 mmHg per new guidelines or 140/90 to 159/99 mmHg. Older standards. At this stage, doctors typically recommend serious lifestyle changes and may consider medication if cardiovascular risk is elevated. Stage 2. Hypertension. Systolic 140 plus or diastolic 90 plus. New standard or 160/100 plus older standard. At this level, medication is almost always needed, often a combination of drugs alongside major changes in diet, exercise, weight management, and stress reduction. Hypertensive crisis emergency. Systolic above 180 or diastolic above 120 mmHg requires immediate medical attention. This is a true emergency that can lead to stroke, kidney failure, heart attack, or brain damage if not treated promptly. The goal of understanding your blood pressure level isn't to make you feel anxious or labeled as sick, but to give you and your doctor the knowledge to choose the right path forward. With the right information, you can take charge of your heart health and proactively prevent life-threatening events like stroke. Truth number 3. The invisible killer. High blood pressure causes damage without warning signs. What makes high blood pressure so dangerous isn't what you feel, it's what you don't. In most cases, there are no symptoms at all. No pain, no fatigue, no dizziness. Even as high blood pressure quietly damages your arteries. Brain, heart, kidneys, and eyes. That's why it's known as the silent killer. You may feel perfectly fine, energetic, even exercise daily, yet inside high blood pressure could be steadily increasing your risk of stroke or heart attack without your knowledge. Many people only discover they have hypertension after a major medical event, and by then it may be too late. In some cases, when blood pressure gets extremely high, symptoms may include severe headaches, especially at the back of the head, dizziness or loss of balance, unexplained nosebleeds, blurred or double vision, chest pain or shortness of breath, and confusion or trouble concentrating. However, these warning signs are unreliable, and they often appear only when the condition has become severe. Waiting for symptoms before taking action is a risky gamble, and sadly, it's one many people lose. The only reliable solution is to check your blood pressure regularly, at least once a year if you're healthy, and more frequently if you're over 50, have chronic conditions, or a history of abnormal readings. A home blood pressure monitor can be a valuable tool to track your numbers over time. What matters most is knowing what's happening in your body, even if you feel fine. Truth number 4. Long-term commitment. Blood pressure control is a lifelong journey, not a temporary fix. Many people assume that once they're diagnosed with high blood pressure, they just need to take medication for a few months and they'll be cured. But the truth is, controlling blood pressure is a long-term commitment, much like maintaining your car or your home throughout the year. Blood pressure medications aren't cures, they're ongoing treatments designed to keep your numbers in check. Different medications work in different ways. Some relax your blood vessels to reduce pressure, like ACE inhibitors or ARBs. Some help the body remove excess salt and fluid diuretics. Others slow your heart rate and reduce its workload, beta blockers. When taken consistently, these medications help maintain stable blood pressure and prevent complications such as stroke, heart attack, or kidney failure. But if you suddenly stop taking them just because your readings look normal, you risk a dangerous spike. This is known as rebound hypertension, and it can have life-threatening consequences. High blood pressure is like diabetes. You don't stop treatment just because you feel fine. Instead, you and your doctor should work together to find the medication that works best for you. Monitor its effects and side effects over time. Combine medication with lifestyle changes in diet, exercise, and stress management. Medication is just one part of the plan, not the whole solution. A healthy lifestyle is the true foundation. The good news is, with the right mindset and support, you can live a full, active life while managing blood pressure if you treat it as a natural part of taking care of yourself. Truth number 5. The domino effect. Uncontrolled high blood pressure harms your entire body. When people think about the consequences of high blood pressure, they usually picture stroke or heart attack. But the truth is, uncontrolled hypertension doesn't stop at the brain and heart. It sets off a domino effect, quietly damaging nearly every major organ system in your body. Blood vessels. The first to be attacked. Chronically elevated pressure damages and weakens arteries over time. It accelerates atherosclerosis, a condition where fatty plaques build up inside artery walls, making them narrower and less flexible. This restricts blood flow and increases the risk of blood clots and aneurysms, a potentially deadly rupture of a weakened artery. The heart overworked and exhausted. When blood pushes against greater resistance in stiffened arteries, your heart has to work harder to pump it out. Over time, this can lead to left ventricular hypertrophy, a thickening of the heart's main pumping chamber. While you might not feel it at first, this thickened heart muscle eventually becomes weak and inefficient, potentially resulting in heart failure. Blocked coronary arteries. Coronary artery disease also raises the risk of angina and heart attacks. The brain sensitive and easily damaged. Your brain relies on a steady, well-regulated blood supply to function. High blood pressure disrupts that balance and is the leading cause of both ischemic and hemorrhagic strokes. It can also cause TIAs, mini-strokes, which often go unnoticed but signal an increased stroke risk. Over time, high blood pressure contributes to vascular dementia, a type of memory loss and cognitive decline caused by poor blood flow to the brain. The kidneys. Silent filters under strain. Each kidney contains millions of tiny blood vessels that filter waste from your blood. High pressure can destroy these delicate filters, leading to declining kidney function. If left unmanaged, this can progress to chronic kidney disease, requiring dialysis or even a kidney transplant. The eyes, a mirror of vascular health. Hypertension can damage the tiny vessels in the eyes, leading to hypertensive retinopathy, which causes blurred vision, bleeding inside the eye, and even permanent vision loss. It can also affect the optic nerve, causing gradual vision decline without warning. Sexual function. Quietly disrupted. Healthy sexual function depends on proper blood flow. When blood vessels are damaged, men may experience erectile dysfunction. In women, high blood pressure can reduce arousal and sensitivity, leading to lower sexual satisfaction and a decline in relationship quality. In short, high blood pressure is not just a bad number on the screen. It's a silent fuse that can set off a chain reaction of destruction throughout your entire body, from head to toe, from physical health to emotional well-being. Understanding it, managing it, and working closely with your doctor are the only ways to protect yourself from the widespread and lasting harm this condition can cause. Knowing these 5 shocking truths isn't to scare you. It's to empower you to take control of your health. High blood pressure is serious, but here's the good news: it can be managed. The purpose of understanding the 5 truths we just covered isn't to make you anxious, it's to give you the tools and confidence to take the right action. Here are simple but important steps you can take to start managing your blood pressure starting today. 1. Know your blood pressure numbers. Checking your blood pressure regularly is non-negotiable. If possible, invest in a clinically validated home blood pressure monitor. This helps you track your readings in a familiar, low-stress environment without the white coat effect. When taking your measurement, rest for at least 5 minutes beforehand. Shallow. Sit upright with your back supported and feet flat on the floor. Don't talk while measuring. Use a cuff that fits your arm properly. And record your readings consistently to track patterns. 2. Adjust your lifestyle. The golden key to a healthy heart. Healthy eating matters. Follow the DASH diet, which is scientifically proven to help lower blood pressure. The foundation includes plenty of vegetables, fruits, and whole grains, lean proteins like fish, poultry, and low-fat dairy, less saturated fat, trans fat, cholesterol, and sodium. Watch your salt-sodium intake. Keep daily sodium under 200-300 milligrams, and ideally under 1-500 milligrams. If you've been diagnosed with hypertension, be cautious with packaged foods, canned goods, and fast food. These often hide large amounts of salt. Boost potassium naturally. Potassium helps counteract sodium's effects. Good sources include bananas, potatoes, spinach, beans, and yogurt. 3. Move your body. Small actions, big results. You don't need intense workouts. Just aim for 150 minutes per week of moderate activity, like brisk walking, swimming, or light cycling. Add 2 days per week of strength training for muscle support. This level of activity helps stabilize blood pressure and improve cardiovascular health. 4. Additional healthy habits that make a difference. Maintain a healthy weight. Losing just 510 pounds can significantly reduce the strain on your heart. Drink alcohol in moderation. No more than 1 drink per day for women and 2 for men. Quit smoking completely. Every cigarette damages your blood vessels. Quitting is one of the best gifts you can give your heart. Manage stress, try meditation. Deep breathing, soft music, or simply going for a walk. These help calm your nervous system and lower blood pressure. 5. Partner with your doctor. You're not in this alone. Your doctor isn't just there to prescribe medications, they're your health ally. Be open about your lifestyle and risk factors. Ask questions about your numbers and treatment goals. If you're prescribed medication, take it exactly as directed. Don't stop unless your doctor tells you to. Report any side effects right away. High blood pressure may be silent, but you can absolutely take control when equipped with the right information and consistent habits. Don't let it continue to do damage quietly. Check your numbers regularly, make heart-healthy choices, and stay connected to your healthcare team. Your heart, brain, kidneys, and your entire body will thank you. Start today. No matter your age, tracking your blood pressure, living a healthy lifestyle, and staying in close communication with your doctor are essential steps toward long-term wellness. Your health is your greatest asset, and caring for it is a lifelong journey. We'd love to hear from you. Have you faced high blood pressure before? Do you have any tips that have helped you manage it better? Leave a comment below because every story, every question, every piece of advice can help others in this community understand and take action. Thank you for watching all the way to the end.